Good afternoon, friends, and we are back again with our live session. Today we have Dr. Asok Sengupta, Senior Consultant Pulmonology, Apollo Gleneagles Hospitals, Kolkata. We'll be discussing tuberculosis. Good afternoon, doctor.
Good afternoon.
Let's start with the most basic question that comes to our mind. What is tuberculosis?
Tuberculosis is a bacterial disease caused by a specific bacteria called Mycobacterium tuberculosis. The name tuberculosis is briefed into TB, and in the general parlor it is also known as TB. TB stands for tuberculosis. It's a bacterial disease only.
The next question that would come to our mind obviously is, how is this disease transmitted, since you said it's a bacterial disease?
The most important way of transmission is when a person with TB, especially a cavitary TB in the lungs, if he or she coughs up, thousands of TB bacteria are thrown into the air, and if that perchance enters the body of another individual, that can lead to TB. That doesn't mean that whenever you are exposed to TB bacillus, TB disease starts in you. As a matter of fact, most of us have been exposed to TB in our childhood, but that doesn't mean that we will get disease every now and then. TB leaves certain impressions in countries where TB is very common, like India and other Southeast Asian countries, but to have the active disease, there should be certain fulfillments of certain other conditions.
Let's discuss the tuberculosis in children. How serious can it be and what are the complications?
Tuberculosis in children is a global burden, but there are certain problems associated with the amount of burden to be determined. Number one, there is lack of standard case definition. Number two, it is difficult to prove conclusively TB in children. And number three, the presence of TB in extrapulmonary situations, that is TB affecting organs outside the lungs in children, is very common. Nonetheless, it is an important disease, especially in under 5 years of age group. It is an important disease globally, and that means TB under 5 years of age presents a particularly difficult problem, because this is the age group where TB can progress to life-threatening diseases such as miliary spread or disseminated TB spread inside the body, or it can affect the vital structures like meninges, coverings of the brain, leading to TB meningitis.
So the next question that comes to our mind is, if you can speak about the common symptoms of pulmonary tuberculosis.
It's a good question, because lungs are the most important organ that can be affected by TB, and most people with tuberculosis of lung, they come up with coughing. There could be a low grade fever, loss of appetite, loss of weight. In children, the children fail to thrive, their growth may be hampered, and occasionally in adults and children alike there could be chest pain, and in cavitating TB giving rise to cavity inside the lungs, the patient can cough up blood. So these are the cardinal symptoms of TB affecting the lungs.
How do you diagnose pulmonary tuberculosis?
Like all diseases, the doctor has to take a good history from how many months or how many weeks the patient is having symptoms, whether there is associated hallmarks of TB such as weight loss, a low grade fever, especially fever in the later part of the day, and the fever subsides at the late evening with night sweats, etc. After that, there should be radiological investigations such as chest X-ray or CT scan of chest or any other appropriate organ. And finally, it's most important to demonstrate or to document the bacterial infection. If it is lung, then the patient is asked to cough up sputum, and the sputum is seen under microscope to look for TB bacillus, the Mycobacterium tuberculosis as it is named. In patients where there is no sputum to be expectorated, the physician or the doctor has to perform a bronchoalveolar lavage, which means a bronchoscopy should be obtained from the lung. A bronchoalveolar lavage should be obtained from the lung to note the presence of TB inside the lung secretions. And there could be other methods as well, indirect methods, especially in children, such as Mantoux test or immunoglobulin assay may be of certain indirect help to diagnose TB.
Sir, if we could briefly discuss the treatments that are possible and the problems these might have.
The TB treatment is more or less standardized for the last 20-25 years. For lung TB, usually there is 6 months treatment. For the first 2 months, we call this period consolidation phase, and the next 4 months is maintenance phase. The treatment duration varies from TB to TB. For example, if there is miliary TB or disseminated TB, the duration can easily be extended to 9 months or 1 year. In difficult situations like MDR TB or XDR TB, the treatment can be prolonged as well. There are certain inherent problems with anti-TB medications. Number one, treatment duration. In the current scenario, the duration varies from 6 months to 1.5 years, 2 years, especially in the MDR TB cases. Also, TB medications come with side effects like any other medicine. Number three, in certain parts of the globe, there could be associated TB and HIV that adds another problem. And another important point associated with difficulties in TB treatment is emergence of bacterial resistance in the form of multi-drug resistant or extreme drug resistant TB. So an ideal TB medication should have eradicated the disease, prevent the relapse, and resist the emergence of bacterial resistance.
What are MDR and XDR TB that you mentioned?
MDR TB, by definition, the TB bacteria is resistant to two most important TB medication, namely rifampicin and isoniazid. And this is common in about approximately 10% of Indian population. And when we come to XDR TB, XDR means MDR TB plus, the bacteria is also resistant to at least one of the fluoroquinolones and one of the aminoglycoside injections.
Finally, before we conclude, if we could just throw some light on BCG vaccination and the latest trends.
BCG vaccination has been in vogue for the last 80 years or so. There has been a lot of confusions regarding real activity and efficiency of BCG vaccination, and this varies from place to place and from one clinical trial to another clinical trial. But one thing is for certain, BCG vaccination has been documented to prevent the onset of difficult type of TB such as disseminated TB, miliary TB and TB meningitis, especially in children. The most controversial aspect of BCG vaccination is its variable consistency from one country to another. A repeated trial in the United Kingdom have proved efficiency of BCG vaccine beyond any doubt, but in other areas of the globe, the trials were not that robust.
Thank you, sir, for sharing your thoughts and discussing with our audience here the details of tuberculosis. I'm sure we'll have more questions from our audience and we'll get them answered by you or your team. Till the next time we connect with you, sir, thanks again. Hope to talk to you again.
Thank you.